Hello, everyone, and welcome to Ask Us Anything. We have a special little feature for you tonight on the discussion of viral isolation, our experience during COVID, and how it affects exercise capacity from an ID lens. The three of us will be talking about that tonight as the co-founders. I'm Dr. Kathy Dooley, one of your co-founders. We also have the amazing Dr. Folkmer here. Hello.
Hi. Hello. Dr. Folkmer, one of your co-hosts and co-founders of Immaculate Dissection.
Thanks for being here, Anna. And the amazing Danny Cork, co-founder.
Hey everybody, Danny, one of the co-founders of ID and the artist for ID as well. So
thanks for being here, Danny. So
yeah, of course.
Jump right to the little chat that we have, and these are some of the things that the ID team has been dealing with in this pandemic, in this respiratory pandemic. The challenges that we face with exercise capacity. One of the biggest things that we're looking at is post-infection decrease in oxygen uptake. This is a big one because, hold on one second. Okay, sorry, folks. The decrease in oxygen uptake is coming from largely the fact that this respiratory illness is kind of special and novel, and the fact that it is severely altering the ability for oxygen uptake into the cells. We have considered COVID to be not only a disorder of respiratory capacity, but also a blood disorder. And because of that, there are certain blood types that are being differently affected. There are people that where it resembles almost altitude sickness. And so this is a special challenge in people having the capacity to be able to exercise if they are post-infection. The restrictions due to home isolation create a massive challenge. Like I own a gym in Midtown Manhattan, and it's been closed since March 16th, which means that people don't have access to where they normally train, and that routine of them going into the gym has largely changed. The clinic closures, now Dr. Folkmer and I are essential employees now, so we are possibly at our clinic, at a reduced capacity, but still the clinics have been closed for a long period of time, and that means that people's rehabilitations and their treatment plans have been largely altered, and that certainly does change exercise capacity due to stability motor control problems and the inability to be able to match stability, mobility, and strength together. So that throws a new wrench into the plans. And that to me has been something I've never experienced, that level of closure, and many people have not in comparison to this pandemic. The reduction in available equipment has been so tragic, it's almost comical, because people have been desperate to buy weights and bands and things on the internet, and they're just now becoming available 12 weeks after the mandatory closures of gyms. So that's been a really interesting part with my telehealth appointments and being creative with equipment like soup cans and detergent and milk jugs. That's been an interesting thing where the exercise capacity for someone can go down because they're like, well, I'm not going to lift unless I have my bells, or I don't have dumbbells, therefore I won't lift. So that's been an interesting, innovative thing that we have to do, because people have a reduction in the available equipment for their workouts. Reduction in breath capacity, especially when wearing a mask. Now, this is one I have dealt with on a very personal level as well as professional level, due to the fact that here in New York, we are required to wear a mask and to be in social environments where you can't keep any kind of a reasonable social distance. And even if you can get social distance, you have to still wear them in places like the pharmacy, the grocery store, outdoor restaurants, takeout. You definitely have to do it. And my patients are complaining that I have such a hard time breathing with a mask on. And so breathing coaching, as we have done on our Immaculate Dissection Instagram, we've shown people how you'd breathe with a mask on. That I think that's helped, but people are having a really tough time with that. So the reduction in breath capacity, wearing a mask, I've seen several people in my neighborhood running with masks on, and they don't exactly look like they're enjoying it. It's very challenging. So that might reduce someone's exercise capacity due to just having a hard time breathing with the mask on, but also it might be a deterrent to them exercising at all because the mask makes them so uncomfortable. So that's been a real thing to think about, how having to modify workouts for patients' comfort levels with the mask. The adjustments to their basic routine have been a big one. I did a home visit yesterday where the patient was complaining that her fitness level has gone down so much because she got a lot of fitness walking to and from work. And now she goes outside and does some walking, but there's still a little bit of hesitance for her to walk too much distance because she's nervous about exposing herself and exposing others should she choose, or should she actually test positive. So that was it has been an interesting piece, especially as New Yorkers, we tend to walk everywhere. The increase in total time sitting, I know has definitely affected me professionally and personally. The resulting in the increased spinal loads for my patients. They're sitting, compressing axially their spines, their intervertebral discs. And then when they have to get up and they want to go work out, they may have a decreased exercise capacity due to the fact they've been sitting all day. And so we all know that an increased time spent sitting does increase lumbar spinal loads. And so getting immediately out of that may be tough for them. And so they may be deterred from exercising due to that. The next to last one here, the poor ventilation while indoors is something that I think is so challenging for us to, as we're ending phase 1 and kind of moving towards phase 2 here in New York. The ventilation issues in our buildings is a big factor. And I did notice this at Catalyst, just going in by myself. I was like, wow, no one's been here in a while. The air is a little stale. And even if it does, start to circulate again, the poor ventilation is linked to increased spread in COVID. So that can be a major concern for people. Do they want to even can they breathe inside? And if they do breathe inside around people, is the ventilation a major issue? Which I think that's going to be something that we really have to think harder about, how we can properly ventilate areas where people are exercising and moving in space. And then last, but absolutely not least, the fear and stress responses. They are limiting the want, the urge to exercise for a lot of my patients. First of all, they're fearful because going outside to them, they just don't know how safe they are. With the recommendations kind of changing week by week, it becomes very hard to know what the right thing to do is. And so I have to be very empathic to their fear with that. And then the stress response, we know that the increase in cortisol released at the wrong times, those adrenocorticoids get released, and you can actually increase systemic inflammation and create an environment where you're more sympathetic and less parasympathetic. Your breath capacity then again decreases, and it's going to be harder for you to have a good exercise capacity. And if you're not exercising with good capacity, a lot of people will just be discouraged from doing it at all. Now, I know, Dr. Folkmer, you probably have a lot to say about those particular things. You have been talking to me and giving some amazing stories. I wanted you to share some of your insights based upon some of those limitations of what you experienced in your clinical practice.
Yeah, I mean, it's so interesting because there's a lot that's disrupted right now. But, one of the big things that I think people are sort of self-assessing and that I'm hearing constantly come up just over telehealth appointments and even in the office when I do have the opportunity to treat somebody is just how disrupted their routine is. And that covers physical activity, but that also covers sleep as well. Both of those things are really, really, really important because, regular physical activity is something that we've known is absolutely critical for just long-term management of anything. And in a lot of cases, it outweighs prescription medication in terms of just the management of chronic diseases. And, when you move more and you sit less and you sleep better, you live longer. Like that's not really it's not a controversial thing to say. Neither is, the fact that our immune system is the way out of this. And so protection of that, support of that, however you can possibly look at it is really, really important. And I think that, as New Yorkers, yes, we're missing opportunities to walk to the train and to walk to our offices and to walk to the grocery store. So many people that would have walked down the street to go to the grocery store to get things, they're now having things delivered. But also it's not even that. I mean, New Yorkers particularly live in small spaces. So even just There's a lot of research that's done on NEAT movement. It's non-exercise activity thermogenesis, which is fancy word for fidgets. It's just like moving around and the little bit of benefit that you get from things like yard work, things like, taking your trash out, going to, schlepping a grocery bag, up a hill from the grocery store, like little things that don't seem as structured as what you might get from a gym facility, but are equally important in terms of, what your body is doing with that information. Also, I mean, sleep, when the day, nobody seems to know what day it is, right? Like, and when the day just sort of happens to you, it doesn't really start or end. That really throws things off too. There were studies that showed that if you sleep less than 5 hours of sleep consecutively over 7 nights, it increases your risk of catching a cold by about 350%. So, that's melatonin. Actually, there's research on melatonin countering some of the COVID virulence as well. So when you're starting to disrupt some of that information, when you're starting to stay up a little bit later and now your day has shifted from 2 a.m. to 11 a.m. that's when you're asleep, versus like waking up, setting alarms and things like that. So I think that we should be using a lot of alarms to remind us to do breathing drills, to remind us to get up and fidget, to remind us to get up and be neat, and to remind us to get up and do prescribed exercises. There's so many fitness professionals, so many movement professionals out there that would love to help people right now. So I think that there's a lot of really, really, really interesting things that sort of suggest we need to be moving more, sleeping better now more than ever, and mindfulness and gratitude as well. There's enormous. I mean, that should be part of your routine. And when the world feels like it's falling apart around you, it's hard to remember to shift your focus there. But there's meta-analysis that are done on that show that, mindfulness interventions improve attention and memory and processing speed and, immunity. So I think that, these are all things that should play a role in our routine, no matter what happens in the world around us.
I 100% agree. And that's a wonderful segue actually back to what we were discussing as far as exercise capacity, because in ID, we focus very strongly on the breath. And in a respiratory pandemic, where we have poor ventilated buildings, we have fear and stress responses that are sympathetic, that are downregulating our ability to maintain good, slow parasympathetic breath. We have a disease that actually affects our ability to uptake oxygen. And, we're in an environment where we can't exercise as much, or we don't exercise as much because it's not a favorable environment. These adjustments to our daily routines and our workout routines become, a pretty important piece to acknowledge, like Anna's saying, like setting alarms. I know for me, an alarm is really helpful because I might get stuck behind a computer for 4 hours if I don't set an alarm to do some get-ups and to do some breathing. So to kind of show you that, like we talk about in Immaculate Dissection what biomechanical rib movement is, and that's the ability to do this thing on the right, which is bucket handle movement of the lower rib cage, to be able to eccentrically load the lateral abdominal wall muscles as the diaphragm drops down. And what that will do is it will decrease intrathoracic pressure by increasing its total diameter. And that makes the lungs fill like a vacuum, which is remarkably effective at being able to get air into the lung. And maybe this may not seem important to someone who has not been hit with COVID, but it's a pretty important time to focus on your ability to have oxygen uptake. And if you have a decreased ability to do that due to a viral overload, or because you're now recovering your post-COVID and now you're rehabilitating your breath, that movement is a crucial piece. So if you just put your hands on the sides of your ribs and imagine that's coming out like a bucket handle when you inhale. If it's not doing that, if it's going straight axially up towards your ears, then you have to remember that that's a stress type response of breathing that's called accessory breathing, and you want to get away from it. The pump handle movement that happens between the upper ribs is happening anteriorly and superiorly. So that movement is actually happening due to the bucket handle movement occurring. So the bucket handle moves and then the pump handle moves. So they happen near simultaneous, but what ends up occurring is because the diaphragm is not actually attached directly to this area, only to the sternal area, you're creating a reflexive response due to the drop in intrathoracic pressure that allows the lungs to fill with air, like that vacuum. It's very much like when you turn on a vacuum cleaner, the old style that had the bag on it, right? Imagine the hose part is going to suck things up because you filled up the bag. And it's very, very similar of how this occurs in the ribs. So being mindful of where your breath is coming from is a big deal to us in ID. It's a huge deal to us in all 6 of the ID courses and both of the Anatomy Angel courses. So all 8 courses, how you get your breath and how you do your breath becomes a really important piece. When it comes to exercise capacity, this is a huge deal because if you're breathing in a stressed place, you're going to get gassed. You're going to get gassed and you won't be able to get your breath in. So just remember how we actually coordinate breath. And we talk a lot about the intrinsic core in ID1 and ID6, but we do mention it in all 6 of the ID courses. The ability to inhale is the diaphragm dropping down. There'll be a pause before you exhale, which is then the diaphragm returning back to its anatomic position. And that involves 6 major muscles that are contracting to elicit a response relative to each other, where the diaphragm is the primary inhalation muscle and all the rest of the muscles kind of participate in an exhalatory cycle. So just to see a superior view of the diaphragm, an inferior view or superior view of the pelvic floor, that's present here. And here's Danny Quirks drawing the diaphragm on himself, which is pretty miraculous in and of itself, but he just shows you the expansive nature of the thoracic diaphragm. And this is the structure that's really going to help you with exercise capacity. COVID or no COVID, it's going to be an important piece. But in times where we're in the middle of a respiratory pandemic, it becomes a pretty important piece. The pressure of everything is going towards the central tendon when you inhale. So all the muscle that you see here is kind of going towards the center as this drops inferiorly towards the lumbar spine. And that allows Danny's chest to fill with air through that pump handle movement. So the side of the ribs are going to be moving up and out through bucket handle. And that allows an expansion through the sternum with pump handle movement. And that's how you elicit the breath. So that's going to be a pretty important muscle for your breathing practice. The rectus sheaths are the tendinous pieces of the anterolateral abdominal wall muscles like transverse abdominis, internal abdominal oblique, external abdominal oblique, and then also they'll connect to the rectus abdominis via these sheaths, these tendons. And we talk about this very much in detail in ID1 core concepts, although it does come up again in ID6 in detail as well when we talk about the intrinsic core and also the anterior oblique subsystem. So these sheaths are there to help co-contraction of rectus to prevent herniation of intestines through the wall and to coordinate the actions of these very strong muscles to counter the diaphragm's movements. So very important during the breathing mechanism. And then thoracolumbar fascia, a lesser talked about structure that most people call the QL on the back. There are these 3 major layers with 2 separate laminates. So there's 6 laminates of fascia that's interwoven on the inside of you, around, adjacent to organs, connecting to the kidney, connecting all the way down to the anterior thigh, connecting to transverse and spinous processes, connecting to the 12th rib and the lumbocostal ligament. What most people think is the QL is actually these important little lines we talk about in ID1, and we do an hour-long assessment on it. It's that crucial. We like to break the myth that everything in the back is the QL muscle, and there's a big posterolateral fill that happens due to the connection of 6 muscles on each side that are not only helping with breathing, but with force transfer out to the limbs. So this area that most people are calling QL is not what they think it is. So it's very important to get a posterior lateral fill, not towards the spine as far. We don't need to breathe through our spine. I don't know why people say that. That's not actually what happens. It's happening out here. And so we talk about that in a lot of great detail. If there's one thing you should be looking at during a respiratory pandemic where there's enormous amounts of stress and a lot of isolation. It's this amazing graphic from Dr. Leon Chateau's book, an excellent book. If you care at all about breathing, you should own it. The book is called Multidisciplinary Approaches to Breathing Pattern Disorders. And this book, and he abbreviates breathing pattern disorders BPD. And so basically are hyperventilatory symptoms. So basically what people will do with a breathing pattern disorder, like one that's post-COVID or just stress from being isolated, is they'll have all of this stuff happen to them. I would definitely call COVID a traumatic event for sure. Not to mention all the tension that we have right now politically. All of this starts to encourage an over-breathing, where there's an increased number of respirations and a lot more exhalations than there should be. This promotes an anxiety response that actually arouses the sympathetics. So anxiety is a very necessary piece in life. Anxiety is crucial to keep you safe, to keep you running from the predator, to get you away from a dangerous situation. But if it happens on repeat, it overactivates the sympathetics. The adrenal chemicals start to get released, and then your pulse increases, your sweat increases, your breathing rate increases. And then you start to get a lot of body tension that shouldn't be there because you're not supposed to be breathing this much. You start to get really uncomfortable, and then you start getting scared something's wrong, and then it perpetuates this cycle here. The cycle also goes down this way, where if you're increasing the total amount of respiratory rates, you're actually reducing the total nitric oxide available to have good exercise capacity. And so if this whole thing we're discussing exercise capacity, you're going to reduce your ability to tolerate the exercise that you used to do, which for a lot of my patients, they're like, why am I getting so gassed when I walk down to the grocery store? Or why do I feel so tired all the time lately? Well, I show them this picture. And then they're like, whoa, there's some science behind that. That's a lot of things. But what it really tells them that it's okay. It's totally okay that you're experiencing this. It's typical of a big problem with anxiety, and should not be considered to be common. It's more typical in this situation, and that there is a way around it. And before you notice the way around it, though, look at what it can actually encourage. We start to lose too much CO2. That's going to alter our Bohr effect, our oxygen uptake, and it creates what's called alkalosis, which is just too much of an alkalinity in the blood because you're blowing off too much CO2 with hyperventilation. If that happens, you start to reduce the carbonic acid in the blood, which is then going to cause you to excrete extra calcium via the kidneys. That's not a good idea, because now you're going to start to get disturbed nerve responses because they respond to calcium-gated channels. So you're going to start to feel numbness in your limbs, which can really freak you out. And if it gets freaked, you know what ends up happening, right? When you get freaked out, you perpetuate this whole thing over again. You can start to disrupt your ability to do smooth muscle contraction, so your digestion becomes off, which is why when you're anxious, a lot of people experience gut symptoms like irritable bowel, indigestion, all related to this pathway. And then you start to just, couple it all together. You're dizzy, you're tired, your exercise capacity has gone down. You don't want to exercise because you feel like crap. You're paresthetic, you can't really move, you can't feel, and you're cramping all the time. A lot of my patients have been complaining lately that they cramp a lot, and they're wondering what supplements they should take. And I'm like, before you do supplements, can we just breathe a little bit? Let's breathe, because this whole thing, as discouraging as it may sound, is altered somatically by the way that you breathe. And you can change all of it in what we call an IDOFM. 1 freaking minute of breathing can alter this entire pathway and make it work more in your favor. So this picture, I'm considering getting it blown up because it's such a crucial piece during not just respiratory pandemic, folks. This is all the time. Our stress, like Dr. Anna was talking about, our anxieties, our fears, our traumatic events in life. I think all of us have had a combination of all those things during this pandemic, not to mention the fact if you've actually had COVID, all of this together encompasses this chart, and it can go really not in your favor or you can alter it with a little bit of breathing training. And that's going to increase your exercise capacity. You start to increase your exercise capacity, you'll start to be able to normalize this pathway again. And it's a win-win if you work on breathing. The first thing that you need to be doing with your clients is making sure this is in check. Because if they just go out running for the sake of running, or they just go swing a kettlebell for the sake of kettlebell, and they come from this place to start, don't expect the workout to fix this. You want to really coordinate the breathing before you go into your exercise. Danny, Anna, you have any words to share with that one?
Yeah, I think that, just like to piggyback back off of what you were just saying, actually, which I think is such an important point, is that like at that, if you're at that point and you're operating from that perspective, then you're only further stressing the system, and you're having all kinds of backlash from that point. And of course, stress isn't an inherently bad thing, but there are, there's an appropriateness to it that has to be certainly be considered and applied. And I spoke with a patient today who had all of these sort of stressed symptoms, but she was like, well, I don't feel stress. I'm normally handle stress very, very well. And it was like, okay, but your body's still going to articulate it in some shape, way, or form. And so just because it's not necessarily here doesn't mean that it isn't coming out in some other way. And so just be mindful that we're in a time and place right now in the world where there's a lot of moving parts. There's a lot of confounding variables. There's, an extra load of compassion that needs to be viewed with that. And and it does sort of kick back full circles. I know that there was studies done on med students during their exams where they basically just looked at their B and T cells during like exam periods. And they found that they actually stopped like producing T cells almost entirely. Like it brought everything to a screeching halt. And that's really impressive to me, that, that your body can be thrown off by something that, that's significant. And so I do think that, I think the other thing is not to be put off by symptoms. Right now, when people are sort of locked in their homes, they feel like any symptom or any sort of like bodily articulation that they have where, things are feeling not quite the way that they would under normal situations, it's very easy to panic about some of that. And, just like Kathy showed with the flow chart, like there's probably a very good explanation of why you're feeling the way that you're feeling. And it doesn't necessarily mean that because there's something wrong with you. It may just be the expression of what's going on and your body's response to what's going on. And I think that's really important to remember, rather than thinking that any symptom is a bad thing. I think any symptomatic expression is a thing to listen to and, take note of. It's some insight into what your body's going through, whether you feel it here or not. Because stress begets more stress, often panic begets panic. And so we can actually, at some point intervene with calm and listening. And there's a fractal effect of that as well. So
I have to agree. I think a lot of people play a blame game with anxiety as if it's their fault because anxiety is so stigmatized. And, it doesn't have to be that way. Anxiety is a very necessary part of life. It should not be stigmatized, but the perpetuation of it does alter your exercise capacity. It alters, I mean, a lot more than that, actually, but that's the topic of today. It's what we're talking about tonight. But I love Chateau's graph because it shows, like, explains, oh my gosh, that's why my gut is off, or that's why my muscles cramp. They would, a lot of my patients would never relate their muscle cramping in their calves to their very stressful work day. And they would just say, like, I was sitting all day, why are my calves cramping? I'm like, well, let me show you this picture. Danny, you had shared with us recently, you had done an awesome video on breathing and positioning. I wanted to ask you from a personal place, because I know you've been working your butt off. You've had a lot of work thrown your way during this, which I'm not surprised about. I'm so glad for that for you. But also, I know that there has to be, like, what you've experienced, like, as in isolation as an artist and putting through all this work. What have you noticed, not as a clinician, but as, a person, on the other side of this? from a personal place of what we're discussing as far as your exercise capacity and your breath capacity?
Well, it's definitely become significantly reduced from what it was like in days prior to. I mean, I'm in Portland. You know, it's a pretty chill, pretty laid back, pretty easygoing place, and the anxiety is just palpable in the streets. Like being a relatively empathetic individual, tend to take on a lot of weight of other people as well, and like just really been getting like this wicked, much more sympathetic mindset than I've had in quite some time. So basically just been making a really avid effort to, as what was kind of said when Anna was bringing it up beforehand, like I've always been really big on using alarms anyways. Like these guys can confirm when we're at the seminars painting, you know, always got them on for tracking and stuff like that. But especially too, like as like the days are just like morphing into blurs and whatnot, like the alarms are kind of like that conscious effort and that conscious place to like really program you into real time what's actually happening and like not getting lost into the void of things. But with that being said though too, have started noticing like a little bit of a reversal on my end, the kind of ironic twist, the way of feeling less anxious is spending more time working. So spending more time working in these compromised positions because, you know, stress, not really breathing properly and not really doing things properly. So have in self, you know, noticed like just pretty much everything that was just mentioned there, you know, like guts not feeling too pretty, you know, just kind of noticing some of the issues that that was kind of having prior to. But, you know, have been making an avid effort to, because of that, take proactive responses and just really schedule in breathing throughout the course of the day. And I mean, it does a few things. One, obviously, you know, it helps to actually set the biomechanics of the body kind of back in line. But also, too, it really does help to kind of recruit that parasympathetic mindset and not be so like pulling hair out in chunks, you know. So
Yeah, to optimize your breathing, you have to be in good position. You have to have the ID cues in check, right? And
mhm.
you know, this is a tough time. We're in a tough place, and tough times call for, you know, your focus and your attention. So in ID, if we're trying to reprogram someone's dysfunctional breath, we teach everyone to do the same thing. And I know we had a question from the panel. It's like it's really hard to change. Of course, it's hard to change, but it you originally were not this dysfunctional, which means you learned it as a behavior. It was a coping mechanism and learned behavior, which means you can unlearn it. If movements of behavior and breathing is somatically innervated by, you know, phrenic nerve to the diaphragm, then you have the power to change it. So one of the first things that we do in ID is we train people how to breathe in supine 90-90. And so we teach this in ID1 in a lot of detail. It takes us literally the entire first day to teach the whens and wheres and whys. But if you're just starting someone off without having to know the whys, you can put them right into this position to make them more optimized and to get into more of what Danny was describing, a better spinal position, and then to immediately hit reset. You can hit an alarm and get on the ground and do a couple of breaths of this. And it is remarkable how OFM, 1 freaking minute of this, can actually change your entire day. So our ID cues are spinal cues to stabilize the abdominal lumbopelvis, and that's neck long in back, chin back, chest wide in front, ribs down in front, and then ASIS, PSIS, hip bones, relatively even, knowing there'll always be a little bit of an anterior tilt. We just want to take them out of an excessive tilt, and we don't want them to posterior tilt. The laws of 45 degrees are making sure everything is angled at 45 degrees. You'll notice that my femur here is slightly externally rotated, but my tibia is rotated in away from that. So that everything's kind of at a 45-degree angle from each other as far as these long bones. Same thing here. You can see that they're at a 45-degree angle from each other here, my humerus and my radius / ulna. So that maintains a good amount of triplanar stability with the limbs, which is always very good for helping to encourage more rib movement. Eyes are straightforward, lasered on a target, lips are together, teeth apart, so you're not clenching your jaw and not doing excessive mouth breathing. And then the tongue is on the roof to open up the epiglottis so that you can increase your laryngeal diameter for breathing in and out. And then you're trying to expand through the lateral aspect, like we talked about before, the lateral rib cage. You'll notice my fingers are on my ribs here because I'm trying to encourage the breathing to happen there. Just by touching that area, even if you're stressed, your brain will go to that area and start to encourage better motor control through that anterolateral rib cage. Nice, long, slow inhales, nice, long, slow, controlled exhales. In ID, we like at least a 1-to-2 ratio of inhale to exhale because the inhale is naturally sympathetic and the exhale is naturally parasympathetic. So just to kind of counter the sympathetic otonia that one might be experiencing with increased stress or respiratory rehabilitation, we do have a little bit more of a controlled exhale. That doesn't mean that you're increasing the respiratory rate. You're not, you're just doing a slow inhale and then twice as long on the exhale, which is going to improve your Bohr effect, improve your oxygen exchange, and get rid of your CO2 safely. The next position that we like is prone prop. Now, this has gotten a lot of notice in the last month. Thank goodness. We've been teaching this at ID for 5+ years, and now it'll be common accepted practice and even considered best practices for people that are post-COVID. It's just so wonderful to hear that people are going on their bellies to breathe. And so you'll see me in the prone propped position here, and I'm right here, I'm in crocodile position or prone position, and then you can actually prop up on the elbows if you want to increase more demand. But for here, you can see that I've still got the same IDQs: neck long, chin tucked, chest wide, ribs down, hips even. My eyes are forward, lips together, teeth apart, tongue on the roof, and I'm just kind of relaxing my femurs, but you can see here I have my toes tucked under just to take some pressure off my lumbar spine. Some people can lay their feet flat in plantar flexion, but for someone like me that tends to be hyperlordotic, I'm going to tuck the toes under just to give a little bit of hamstring awareness to control a hyperlordosis. I'm not at any time posteriorly or anteriorly pelvic tilting. I'm trying to keep a relative neutrality in the pelvis. And again, breathing through the lateral rib cage, but really making sure to get that thoracolumbar fascia involved. That fake QL is what we call it. The long, slow inhale, the long, slow, controlled exhale. Okay, so that's what we do in Immaculate Dissection, courses 1 through 6, and also the 2 anatomy angels. You never get a pass from us, whether you're going through a respiratory epidemic, a pandemic, or not. Everyone has to do quality breathing training. And we do think, because of the nature of this talk being exercise capacity related, that wouldn't this be wonderful to do between sets of your workout? Like if you watched Dr. Anna's amazing push-up video, maybe you decided to do some push-ups and improve your cardiovascular output, improve your whole body compound strength, and you're using all your ID cues, but your exercise capacity is shot. So maybe you decide, I'm going to cut it from 10 push-ups to 5 push-ups, and in between I'm going to do supine 90-90 and prone breathing, just to increase my oxygenation, to improve my total exercise capacity. And then maybe I do 4 sets of 5 instead of just doing 2 sets of 10. It's still the same amount of capacity, but the person may perceive it as being a little less challenging, which might increase motivation and decrease their stress, improve their outcome. So maybe their workout has to change a little bit during this time to be more favorable towards what they need. One of the things I'm hearing a lot in my telehealth sessions is I can't do what I did pre-COVID. And I say to them, why would you expect yourself to? Like it's just a big ask. Why don't we meet you where you're at? And our great ID motto is meet you where you're at, take you where you're not. It doesn't make much sense to do what you did pre-COVID right now. You're not in the same situation. Your activities of daily living are completely different. Your routine is different, and possibly your exercise capacity is quite changed. So let's roll with it. Dr. Folkmer, what can you add to that as far as breathing practice and exercise capacity?
Yeah, I mean, I would just say that, the effects of stress, I mean, just to reiterate the fact that they aren't an inherently bad thing. Stress is what helps us perform at our amazing human potential. And so the observation of our human potential is, seen in exercise goals and seen in, all of the things that people are reflecting on. That part of it didn't necessarily go anywhere. It's just, like you said, maybe that's not exactly what your body needs at this given moment. And so having ways to moderate the effects of that in your body, changing your workouts a little bit more so that they're helping you withstand the fact that you're sitting in front of a computer a little bit more, or that you are sleeping a little bit better, or, like you said, if you are recovering from a viral infection, COVID or not, all of these things are very rehabilitative, and maybe it's not performance goal oriented right at this very second, Or maybe the performance goal has just shifted. Maybe the performance goal isn't necessarily a PR. Maybe the idea of a PR looks different because you're trying to just overcome what your new normal looks like at this given point. And I think that, we're very quick to vilify stress, but I think that the reminder of stress tells us how many amazing things that we can do, and we can take that and channel it into a different direction to know that we're going to be okay. And, take all of these very rehabilitative things and support that idea and say, hey, we're going to do some breathing right now because that's exactly what your body's telling you that you need. And it's not out of reach. Even if you've been doing it, in a dysfunctional way for a long time and it's gotten you up to a certain point, maybe we can take the potential of all the other amazing things that you have also sort of that have coincided with that, and take that energy and just shift it a little bit right now. So, there's really just sort of shifting blame and not vilifying things right now. This is just about observing where you are and understanding that, okay, this is where we are today. And that's exactly what we repeat in ID classes constantly. It's just meet somebody where they're at and help take them where they're not. And, that's okay. That's a little bit different every single day.
Absolutely. I think that we have to get people away from that idea that they're going to be the same that they were before. Nothing's the same. And I share with them, I'm not the same. My workout capacity has changed. It's different, and you have to embrace that change in order to be able to adapt and then find a new and better normal. Maybe you'll end up better than you were before because of that stress. Stress makes diamonds, right? It's a necessary thing. So rather than just push yourself aside and say, I'm anxious, I'm stressed, I'm not going to work out. Instead, that those things, according to Chateau's chart, are going to end up very much ending poorly for you. A world of symptoms can result, and it can just decrease your quality of life. So instead, we're going to say, I recognize that I'm anxious, and I'm going to befriend that anxiety and understand it better. I'm going to improve my exercise capacity slow and surely. Like the military term, slow is smooth and smooth is fast. And so if you're finding yourself in dysfunctional breathing, I know I am. I'm enduring quite a bit of stress right now, just like everyone else. And I have to check in with myself, or else I feel myself get a little irritated. And I'm like, ooh, it's so fast to get thrown off your axis. But you have an alarm like Danny uses and Anna uses. You have an ability to set an alarm. And the days where I set those alarms, those days go way better than when I don't. So I have to, admit that I don't always set the alarm, but the days that I do, my overall disposition's better, my exercise capacity is better, my output's better. And so consider it. I know it may be a nuisance to hear it go off and like, oh, I got to stop what I'm doing, but it might result in your overall exercise capacity becoming more improved as you go along. Well, we certainly do hope that you guys got something out of tonight. We loved talking to you about viral isolation and exercise capacity. Important passion project for us in ID is always breath. And it seems to be the topic of choice, breathing everywhere. And we love that it's being talked about. And we love that we can contribute in any way to you, helping people understand how to do functional breathing and then learning how to take people to the next level. Any last words of wisdom, Danny? Anything you want to share before we sign off?
Where are you there? Yeah, no, I think what was really nice about tonight's talk, though, was really kind of helps, especially when everybody's kind of in a freaked out state or like worried about stuff, especially when that thing that everyone's freaking out about is about breath and about whatever else. It really kind of helps to know what that maybe things you're feeling or things you're experiencing aren't, the virus or aren't whatever else. And just kind of learning some of the mechanisms that stress creates towards breathing and has on the body there. Like, I think this could be really helpful for a lot of people, and, kind of bringing them back down to calm, bringing them back down to kind of where they were beforehand and not feel so kind of defeated or consumed by what's kind of happening around them. And that's definitely going to be really helpful for, even if not returning back to where you were prior to, at least walking in the direction of. So.
Absolutely. Wonderful. And then Anna, any last words from our amazing panelists here, word of wisdom to share?
I would encourage people to just embrace the time that we have right now. I know that there's been a lot of certainly metabolic studies that show that things can change significantly in a short amount of time, like as little as 4 weeks, we can change like entire health profiles. And I know anybody that's ever, followed some sort of plan has seen major shifts in, a fairly small amount of time. And so right now, one of the things we do have on our side is time. And that's a thing that when we don't have, it's a thing that people certainly want. So I think that there are ways to make the most of that and get reacquainted with certain parts of yourself. And yeah, we just certainly want to put out whatever information we can to help people with that. So
absolutely. Well, we encourage you as ID listeners to meet yourself where you're at and take yourself where you're not before you're ready to help your clients, even before you start your day on telehealth or in person. Meet yourself where you're at. If you're not okay, it's okay. But it's not okay to know that you're okay and not do anything about it. I mean, it's your responsibility to take care of yourself because no one else will. You got to do it yourself. So we're going to share links to our Supine 9090 and our prone breathing in the YouTube clip for this video. So if you want to go back and watch this video again on viral isolation and exercise capacity, we would love, for you to watch it. And then in the description on YouTube, it'll have hyperlinks to both Supine 9090 and crocodile breathing. And we suggest starting with OFM, 1 freaking minute of each, and setting your alarm like Danny and Anna had suggested can be like 2 minutes. Who doesn't have 2 minutes? Everybody's got 2 minutes right now. Everybody's got a lot of time right now. So give yourself 2 minutes, and that 2 minutes can really shift you. Better oxygenation of tissues, better uptake of calcium, less secretion by the kidneys, less aberrant nerve responses and cramping due to calcium regulated channels. Like these are things that you can change with a couple of breaths, man. Why not take them? No medication needed, no prescription needed, other than we'll give you the ID script of OFM. So give it a shot, and show us, give us some comments, let us know what you think. And if you want to go into the depths of it, our ID1 online course is 15 hours of breathing training, and we love it. It's the one that we've known the longest, we've done the most. And then if you want to see how the intrinsic core deals with the entire movement subsystems, our ID6 coursework would be right for you. So thank you so much for joining us tonight for Ask Us Anything. Thank you for your awesome questions. And we won't be here next Sunday. It's Father's Day, but we will be here in 2 Sundays. So we'll see you in 2 Sundays, and we hope you have a great night.